John had always been a strong, dependable man. A father of 3, retired electrician, and the kind of guy who fixed leaky faucets for neighbors without being asked. But lately, something had changed. A nagging discomfort lingered deep in his lower abdomen, and late-night trips to the bathroom had become the norm. What troubled him most wasn't just the physical pain, it was the embarrassment, the confusion, and the silence that surrounded it all. That silence has a name: prostatitis. Prostatitis is a condition many men never talk about, either because they're too embarrassed or because they simply don't understand what's happening to their bodies. But the truth is, millions of men worldwide live with this daily pain, unaware that it's something that can be managed, even improved. It's not just a medical issue, it's a quality of life issue. Prostatitis can cause persistent pelvic pain, problems urinating, discomfort during int***macy, and emotional frustration that few are willing to admit. And if left unaddressed, it can slowly wear away at a man's sense of self, his confidence, and his joy in everyday life. But understanding this condition, the causes, the types, and what you can actually do about it, is the first step to reclaiming control. Before we get started, I'd love it if you'd give this video a like. It helps me keep sharing important lessons. If you're not already subscribed, I encourage you to hit the subscribe button and turn on notifications so you don't miss out on new videos. Also, if you like this video, write a 1 in the comments and a 0 if you don't, so I know what can be improved. So, here we go. 1. Chronic pelvic pain syndrome, CPPS. John had always prided himself on being the kind of man who didn't complain about pain. A little backache, some stiffness after yard work, he'd shake it off. But this was different. It began as a strange pressure, somewhere deep in his lower abdomen, hard to pinpoint but impossible to ignore. At first, he thought maybe he'd strained something lifting the dog food bag, or maybe it was from sitting too long in the car on the drive to his daughter's place. But the feeling didn't pass. In fact, it got worse. A dull ache began to settle between his legs, sometimes radiating into his thighs or wrapping around to his lower back. Urinating became uncomfortable. Sometimes there was a slight burn, sometimes a hesitancy, as if something inside was resisting. He tried to shrug it off. After all, things change as you get older, but deep down, he knew this wasn't just age catching up. After a few weeks, his wife urged him to see a doctor. The physician ran tests, checked for infections, asked the usual questions. Nothing came back conclusive. John was given antibiotics, just in case, but they didn't help. A few weeks later, he saw a specialist. More tests. Still no answers. By now, he was waking up several times at night, not always from the need to use the bathroom, but from a strange pressure or discomfort in his groin. int***macy had started to feel different too. Not painful exactly, but there was a lingering tension, a sense of tightness that made him hesitant. Every time he thought about reaching out to his wife, the thought of discomfort crept in and kept him still. He started avoiding long car rides, skipping social events, even dreading sitting through church. Every seat seemed too hard, every meal with family too long. Worst of all, nobody really understood. "It's probably stress," one friend said. "Maybe a pulled muscle," another offered. But John knew it was more than that. It wasn't constant, but it was consistent. There was always some reminder, some twinge or discomfort that never truly left. What frustrated him most was the lack of answers. No infection. No visible swelling. No tumors. Just pain, and no one could tell him why. Eventually, his urologist said the words he'd never heard before: chronic pelvic pain syndrome. CPPS. The name didn't sound particularly threatening, but the truth behind it was sobering. This was the most common form of prostatitis, and yet it was also the most misunderstood. There was no bacteria, no obvious cause, and often no clear cure. Just a pattern of pain, sometimes mild, sometimes sharp, that settled in like an uninvited guest. John was told it could be related to stress, to muscle tension in the pelvic floor, even to past trauma or lifestyle habits. It made a strange kind of sense. He'd carried a lot of stress silently over the years. Lost his brother 2 winters ago. managed his wife's illness last summer, held it all in, as men of his generation often do. His body, it seemed, had decided to speak when he no longer could. Treatment wasn't simple. There was no one-size-fits-all approach. His doctor talked about physical therapy, learning to relax the pelvic floor muscles, and even mentioned something called nerve hypersensitivity, where the nerves keep firing pain signals even after the original problem is gone. John listened, nodding slowly, absorbing a new reality. This wasn't going to be a quick fix. But for the first time in months, he felt seen. Not dismissed. Not told to just deal with it. CPPS wasn't a death sentence, but it was a lesson. A lesson in listening to his body. In slowing down. In learning that not all pain shows up in blood work, and not all healing comes in a bottle. It was humbling, yes, but also strangely empowering. Because now he had a name for what he was going through. And more importantly, a path forward. 2. Asymptomatic inflammatory prostatitis. The illness you don't know you have. For many men, the scariest part of growing older isn't the pain you feel. It's the health issue you don't even know is there. That's exactly what makes this second type of prostatitis so unsettling. Asymptomatic inflammatory prostatitis. It's a mouthful, and at first glance, it doesn't sound like something you'd need to worry about. After all, there's no pain, no burning, no urgent trips to the bathroom in the middle of the night. You feel fine. And yet, under the surface, something may not be right. Take Robert, a 67-year-old retiree who went in for a routine checkup. He felt healthy, still played golf twice a week, and had no major complaints. His doctor suggested a PSA test and a prostate exam, just to be thorough. A few days later, the results came back showing signs of inflammation in his prostate. Inflammation? Robert asked, puzzled. But I don't feel anything. That's the thing. Asymptomatic inflammatory prostatitis doesn't announce itself with pain or discomfort. It's usually discovered by accident, during tests for something else entirely. The body, in its quiet way, has been mounting a response to something, but without sending out the usual alarms. The doctors don't always know why it happens. It could be a lingering immune response, a minor infection long since cleared, or a result of other conditions in the body. Sometimes, it goes unnoticed for years. Other times, it shows up in fertility tests, or during screenings for prostate cancer, prompting more questions than answers. Robert asked the question anyone would, is it dangerous? The answer was, maybe not now, but it's worth keeping an eye on. While this type often doesn't cause symptoms or require treatment, it can still matter, especially if inflammation lingers. Some doctors believe chronic inflammation over time could be linked to more serious prostate conditions, though the science is still evolving. Robert didn't need medication, but he did need awareness. His doctor advised regular follow-ups, a healthier diet, more hydration, and staying active. Inflammation, after all, can be influenced by lifestyle just as much as by biology. Robert walked away with a clean bill of health, but also with a new respect for the idea that sometimes the absence of pain doesn't mean the absence of risk. For men like him, silent conditions like this one are a reminder of why regular checkups aren't just for when something feels wrong. They're how you catch the things that don't feel like anything at all. 3. Chronic bacterial prostatitis. The infection that keeps coming back. Michael was no stranger to hard work. A former mechanic with grease-stained hands and a quiet strength, he was used to pushing through discomfort. But over the past year, something had started nagging at him. Every few months, the same pattern would return like clockwork, burning when he urinated, pressure low in his belly, aching in his groin. It was more than just an annoyance. It interrupted his sleep, made him dread using the bathroom, and even began affecting his confidence behind closed doors with his wife. The first time it happened, his doctor told him it was a urinary tract infection. He was given antibiotics, felt better within days, and went on with his life. But weeks later, it came back. And again. And again. Each time, the same process. Antibiotics, relief, recurrence. By the third or fourth round, Michael wasn't just frustrated. He was tired. Not just physically, but emotionally. Every time the pain returned, it reminded him of something he thought he had already beaten. It made him question his health, his strength, even his future. Eventually, a more thorough examination revealed what was really going on: chronic bacterial prostatitis. A persistent bacterial infection that lives deep within the prostate tissue, flaring up every few months like a stubborn fire that never quite goes out. The prostate, small as it is, can be a difficult place to treat. Some bacteria burrow in and become hard to reach, even with antibiotics. That's why the symptoms come and go. It isn't that the infection disappears completely. It just hides. Michael's doctor explained that treating this condition is about more than just throwing antibiotics at it. It's about patience, persistence, and finding the right combination of medications and timing. Sometimes it requires longer courses of antibiotics. Sometimes additional tools, like anti-inflammatories, alpha blockers, or even changes in daily habits, are brought in to help reduce the pressure and inflammation. Lifestyle played a part, too. Michael was told to avoid too much sitting, drink more water, limit caffeine and alcohol, and begin pelvic floor stretches to ease muscle tension. At first, it felt like too much. Too many changes for a man who had lived the same way for decades. But when he thought about living the rest of his life under the threat of that pain returning, he knew he had to try. Chronic bacterial prostatitis isn't always dangerous in the way a heart attack or stroke might be, but it steals quality of life in small, exhausting ways. The fear of the next flare-up. The fatigue of endless treatment cycles. The way it quietly shapes your schedule, your mood, your ability to enjoy the moment. But with a determined doctor, a tailored plan, and a patient mindset, many men do find relief. Not instantly, and not forever, but enough to reclaim comfort, control, and the confidence that they are not at the mercy of their condition. Michael still has bad days. But they are fewer now. And for a man who once thought he'd be living in 3-month cycles of pain for the rest of his life, that's no small victory. 4. Acute bacterial prostatitis. When the body sounds the alarm. It hit Thomas like a freight train. One moment, he was watching the evening news with a cup of tea in hand, and the next, he was doubled over in pain, shaking with chills, unsure whether to lie down or call for help. He hadn't felt right all day. There was some pressure when he urinated, and his lower back felt tight, but he chalked it up to age. Then, suddenly, he was burning up. Fever rising. Pain sharp and unforgiving across his lower abdomen. His wife didn't hesitate. She helped him into the car and drove straight to the emergency room. At the hospital, things moved quickly. The nurse took one look at his vitals: high fever, rapid heartbeat, trouble urinating, and rushed him through. Within the hour, he was diagnosed with acute bacterial prostatitis, a sudden and serious prostate infection that doesn't ask politely. It storms in, loud and aggressive, and demands immediate attention. Unlike the other types of prostatitis that can creep in quietly or linger in the background, this one is blunt. There's no mistaking it for stress or muscle pain. The body is in full defense mode: fever, chills, intense pelvic pain, and a burning urgency to urinate, often with little success. It can even lead to urinary retention, where the bladder fills but won't empty. A dangerous situation that can cause further complications. For Thomas, the diagnosis was a shock. He didn't even know prostatitis came in different forms. He'd heard of prostate cancer, sure, and maybe a few vague mentions of enlarged prostate among his friends, but this was different. This wasn't slow or quiet. It was a full-body emergency. And the doctors told him he'd come in just in time. Left untreated, acute bacterial prostatitis can lead to serious complications: abscesses, bloodstream infections, or even sepsis, a life-threatening reaction to infection. Fortunately, Thomas was treated right away. Intravenous antibiotics, fluids, pain management, and a few days in the hospital to stabilize. Recovery wasn't easy. The pain didn't disappear overnight. He needed rest, follow-ups, and a careful course of oral antibiotics at home. But with each passing day, the fog lifted. And he realized how lucky he was. Acute bacterial prostatitis is a reminder that the body does speak up, sometimes loudly. And for men over 50, especially those who tend to push through symptoms or wait just one more day before calling the doctor, that instinct to delay can be dangerous. When your body sends a signal this strong, listen. Get help. Because time matters. Thomas eventually returned to his old routine. Slow walks with his dog, breakfast on the porch with his wife, Sunday barbecues with the grandkids. But something had changed. He paid closer attention. He stopped dismissing discomfort as just part of getting old. Because now he knew, some signals are warnings, and some, like this one, are alarms. And when the alarm sounds, it's not weakness to ask for help, it's wisdom. It's not just in your body, it's in your mind too. Prostatitis doesn't only settle in the prostate. It settles in the mind too. And that's the part nobody talks about at first, the slow erosion of confidence, comfort, and connection. For men like John, Michael, Robert, and Thomas, the physical pain was only half the battle. The other half was quieter, but just as heavy. It starts with frustration. Why isn't this going away? Why can't doctors find a clear answer? Then comes doubt. Is this just in my head? Am I overreacting? Slowly, that doubt becomes isolation. Because when you're dealing with pain that no one else can see, and that you don't fully understand yourself, it's easier to withdraw than to try to explain. You smile through dinners. Nod along in conversations. Say, I'm fine, even when you're not. And behind closed doors, it wears you down. The mood shifts. Sleep becomes fitful. You might snap at people you love without meaning to. Or worse, you pull away from them entirely. That's the emotional toll prostatitis takes. It's not dramatic. It's not the stuff of emergency rooms. But it's deeply personal. A kind of loneliness that settles in your bones, especially when the discomfort touches every part of daily life. Sitting, walking, using the restroom, even being mate. Many men stop initiating affection, not because the desire is gone, but because the discomfort makes them afraid of rejection, of embarrassment, of hurting. And over time, that distance can feel permanent. But here's the truth. The earlier you recognize the symptoms, the better chance you have at turning the tide. Pain in the pelvis. Discomfort when urinating. A burning sensation that comes and goes. Pressure, heaviness, or even pain during or after MACE. These aren't signs to ignore. They're not just part of aging. They're messages from your body. And the longer they're brushed aside, the more complicated the condition can become. Some doctors and studies suggest that regular but moderate ejaculation may support prostate health by keeping fluids moving and preventing blockages. Others warn that excessive masturbation or overactivity might worsen inflammation in certain cases, especially during a flare-up. What's important isn't to fall into fear, but to seek balance, and more importantly, to seek guidance. Every man's body is different, and healing often begins with honest conversations. With your doctor, your partner, and most of all, with yourself. So many men live in quiet pain because they believe this is something they have to endure alone. But you don't. And the moment you stop trying to push through in silence, and instead begin to listen, learn, and speak up, that's the moment healing truly begins.